Hi, everybody. My name is Lucella Sigalski. I'm the job coach from Nationality Service Center, or NSC. I'm member of the Department of Employment Services. And today we are going to talk about a very important topic, especially during COVID-19, which is the basic leave. And for this presentation, we have one of my colleagues. Her name is Emma Bailey. She is the job developer in our team. Thank you so much for joining us today, Emma, and thank you so much for taking the time to share this information with our NSC clients. Welcome.
Thanks, Luisella. Hi, everyone. I hope you're all staying healthy during this time. Like Luisella said, we're going to talk about paid sick leave, specifically during the COVID-19 crisis. Okay, so the first thing we're going to talk about is kind of the umbrella term, which is the Families First Coronavirus Response Act, and that can be shortened as FFCRA. Like I said, that's the umbrella term, and then there are two acts that come off of that. The first one is the Emergency Paid Sick Leave Act, or EPSLA, and the second one is the Emergency Family Medical Leave Act, which is EFMLA. And the next topic we're going to talk about, which is separate, are the specific to Philadelphia city laws when it comes to paid sick leave. So just as an opener, you're only eligible for one or more of the options above if your employer is still open, or in a more common way to say, if your employer is considered essential, you're eligible for one of these acts. If you were laid off or furloughed before April 1st, or if your employer has closed but said they'll offer you your job back when they open again, unfortunately, you're not eligible. So there are 6 reasons that you are able to qualify for the Families First Coronavirus Response Act. In order to get money from this act, you have to qualify for one of the 6, as well as your employer has to have fewer than 500 employees, and you can prove that you cannot work remotely, including one of these 6 qualifying reasons. So the first one is that you're subject to a federal, state, or local quarantine or isolation order related to COVID-19. Number 2 is that you have been advised by a healthcare worker provider to self-quarantine during COVID-19. Number 3 is that you're experiencing COVID-19-like symptoms and you're seeking a medical diagnosis. Number 4 is that you're caring for an individual subject to an order described in number 1 or in number 2. Number 5 is kind of an important one to remember. There are different rules that come along with number 5, and this one says that you're caring for a child whose school or place of care is closed or the child care provider is unavailable for reasons related to COVID-19. And number 6 is that you're experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services. So these are the 6 reasons. You only need to prove one of them, as well as that your employer has fewer than 500 employees and you can't work remotely.
So less than 500 employees.
Yes. So places like big grocery stores or chain restaurants, those will say that they have more than 500 employees because as a whole, the company has more than 500 employees. Does that make sense?
So they don't qualify in that, obviously, in that case.
Right.
For this benefit in particular.
Right.
Okay.
So what specifically is the Families First Coronavirus Response Act? So it started to be in effect starting April 1st, and it is going until December 31st, 2020. Right now, that end date is kind of up in the air, so it could be extended if it needs to be. So the Emergency Paid Sick Leave Act, which is EPSLA, you will get 2 weeks, which is equal to 80 hours of paid sick leave at your regular wage. If you're part-time, you're entitled to compensation for how much you normally work in 2 weeks. If you're normally work more than 40 hours per week, which means you work overtime, you're entitled to that number of hours wage, but it's capped at 2 weeks. For the Emergency Family Medical Leave Act, if you worked at least 30 days before asking for paid sick leave, and your reason is number 5, just as a reminder, number 5 is that you're caring for a child whose school is closed, you could be eligible for an additional 10 weeks of paid sick leave covered by the Family Medical Leave Act. So with the Family Medical Leave Act, you could be eligible for up to 12 weeks of paid leave.
So that one is kind of like a modification of the regular FMLA, which is not it's a non-paid sick leave.
Right.
In medical.
Yes. Okay. So some of the logistics which connect to the reasons from the previous slides. Reasons 1 through 3, you're entitled to 100% compensation for 2 weeks. So you'll be paid at your regular wage for 2 weeks. For reasons 4 and 6, you're entitled up to 2/3 or 66% of your compensation for 2 weeks. And then for reason number 5, which is the special one, you're entitled to, again, 2/3 compensation for 12 weeks. And just as a reminder, part-time employees are eligible for the equivalent of what time they'd normally work or get paid in that 2-week time frame. Okay, now talking specifically about the duration of the leave. For reasons number 1 through 4 and reason number 6, a full-time employee is eligible for 80 hours of leave, and a part-time employee is eligible for the number of hours of leave that employee works on an average of a 2-week period. So 80 hours of leave is 2 weeks paid sick leave. That's just the normal paid sick leave amount of time and amount of pay.
So what would be like the best example for a part-time employee, Emma? So if we have a client who is been working for 30 hours every week.
So if someone's working 30 hours, you are paid for those 30 hours and that's it. So if you usually work 30 hours a week, you'll be paid for 30 hours.
For those 30 hours?
Yes. Okay. If you usually work 15 hours, you'll be paid for those 15 hours. Okay, so then reason number 5, the duration of the leave is a full-time employee is eligible for up to 12 weeks of leave, 2 paid weeks, and then followed up by another 10 weeks of paid leave going with the Family and Medical Leave Act at 40 hours a week, and a part-time employee is eligible for leave for the number of hours that the employee is normally scheduled to work over that period. So those are similar. Reason number 5, you just get an extra 10 weeks. But just as a reminder, you do have to be on payroll for 30 days prior to asking for this paid sick leave to qualify for reason number 5. This goes along with what I just said. How do I qualify for the Family and Medical Leave Act? The employee must be on payroll for 30 days preceding this claim. The employee must demonstrate that they cannot work remotely, and the employee must be caring for a child or someone who is sick. And then you're eligible for the whole 12 weeks. Next, we can talk about what do I have to do to get paid sick leave. So for reasons 1 through 4 and 6, you'll have to give these things to your employer. So you'll have to include your full name, the dates for which you request your leave, the reason for your leave, and a statement that you are unable to work because of the reason above, as well as if you request leave because you are subject to a quarantine or isolation order, you should provide the name of the government entity that issued the order, or if you've been ordered to self-quarantine based on the advice of a healthcare worker, you should also provide that doctor's note or some written information from the doctor saying that you should self-quarantine for 2 weeks. And for reason number 5, you need all of that information from reasons number 1 through 4 and 6, as well as this information that we're going to go over. So in addition, you need the name of your child, the name of the school, place of care, or child care provider that is closed or has become unavailable, a statement that no other suitable person is available to care for your child. In addition, you need to provide your employer with written documentation in support of your paid sick leave as specified in applicable IRS forms, instructions, and information. So you do need to provide documentation from a doctor, from a healthcare provider, some form of documentation that says your child's school is closed or the daycare is closed and no one else is suitable to care for your child. And then all of these things are sent to the employer. Okay, so Philadelphia city laws, this is just broad. Starting May 13th, 2015, employees who work at least 40 hours a year within the city of Philadelphia limits will be eligible to earn paid and unpaid sick leave. So employees are eligible to earn 1 hour of sick time for every 40 hours they work, and you accrue those hours the more you work. And employees with 10 or more employees are required to provide paid sick leave. Employers with 9 or fewer employees are required to provide unpaid sick leave. And that's just something to keep in mind when you're thinking about what type of place you work in. That could be pretty important. So that's the whole presentation. I hope it makes it a little bit easier and a little more clear for everyone. If you have any questions, these links are really helpful. They have a lot of FAQ sections and more specific questions that can be answered that we didn't include or that you have specific questions on because of the place that you work or kind of what to provide to ask for paid sick leave. If you have any really specific questions or need help with paid sick leave, feel free to reach out to anyone on the employment team, specifically Dana or I will be able to help you kind of work through it.
Yeah, so in if they have any like further questions, is would be good to reach out to you or Dana. And in case, I think it's safe to say, like in case they think they, based on the information you just provided, if they want help and they think they qualify for any of these benefits, they can go ahead and contact their current case manager, right?
Yes. If you need help getting in touch with someone from the employment team, I would say contact your case manager and they'll be able to put you in contact with one of us.
Well, thank you so much, Emma. I appreciate it. I hope you guys find all this information very helpful. And like Emma said, feel free to send an email to either Emma or Dana, or also you can contact your case manager, and your case manager would be the person who will be helping you to file for any of these compensations. Well, thank you so much, and thanks for watching, and thanks for joining us today, Emma. I appreciate it.
No problem.
Hope to see you in another video very soon. Bye-bye.